Welcome to the University of Washington School of Nursing Voices of Nursing podcast, where we dive deep into the diverse and inspiring stories from the heart of healthcare. This is Voices of Nursing. Welcome, and thank you so much for joining me with a conversation today with Dr. Alexi Vasbinder, scholar, faculty member at University of Washington School of Nursing in the BNHI department, whose areas of expertise encompass precision health, informatics, and more recently, digital health innovation, and was a finalist for our Dawg Tank School of Nursing event. So we're very excited to have Dr. Vasbinder here with us today. But can I call you Alexi?
Yeah, or just Lexi is fine.
Or just Lexi. Okay,
yeah.
Great. Thank you so much for joining us today.
Yes, thank you. I'm excited to be here.
Yeah, excited to have you here. We're really looking forward to hearing about a couple of things. The first part is just about your journey and how you got to this point. You know, what led you to the University of Washington School of Nursing, and, you know, hopefully get to know a little bit about you as a human too.
Yeah, so it's kind of an interesting journey. I'm not one of those people that grew up saying like, oh, I want to be a nurse. Like, that was not actually anywhere in my growing up years until college. When I started college, my dream was actually to be an archaeologist.
That's a great dream, though, arguably.
Very, very different than where I ended up now.
Yes.
It wasn't until I took like my first class that I was like, this is actually really boring. But one thing that I liked about it, and something that I think drove me to where I am today, is I was really interested in discovery. And I think like what's exciting about archaeology is like, oh, you can like go somewhere and like dig up some stuff and maybe you'll find something cool and new and exciting. And that was really interesting. But the rest of it was like, ooh, not for me. Mm-hmm. So then I was kind of deciding like, okay, well, this isn't for me. Like, what else can I do? I dabbled down kind of the engineering route for a little bit. You know, I was really interested in like kind of math and science, and that was an area that I excelled in, and I was really good at kind of the analytic aspect of it and math and statistics. But I didn't really know where I wanted to like take that. I feel like it didn't have like an end goal of something that I was like really passionate about, but how could I apply those tools to something that I did care about? And when I was an undergrad, I worked in a research lab. I started for money, like most people do.
Yeah, reasonable.
Yeah. But it was really exciting because I got to see how research, which is all around like kind of discovering something new, which is something that I really liked about archaeology, could be applied to like something that was very upfront, like health and healthcare, and how to like make a difference in people's like actual lives. And when I was in that lab, you know, kind of started out by just doing like more of the basic, like washing dishes and, you know, keeping inventories. And then as I started to work more in the lab and become more familiar with the people, I got to do more of the hands-on. So I got to do a lot of like kind of experiments, and I got to take on some of my own mini projects. And that was really exciting because I was kind of discovering something new, but it had an actual application. And the work we were doing, I could see was leading to like actual like, clinical trials, like drug development, things that were going to make a difference. But in that space, we were looking at very, very rare genetic neurological diseases, which was very interesting, and it's very, very important. But I wanted to do something where I was going to have a little bit of a larger impact. So then as I was kind of putting all of these like pieces together, like I was interested in like discovery and research, and I was interested in health, and I was interested in kind of math. Like, what could I do with all of these three pieces?
What brings it all together?
Yeah. And I knew I needed a clinical background to be able to like have an impact in health and disease. So I ended up deciding to go to nursing school after I had graduated from my initial undergraduate degree to get that clinical expertise. And I kind of had that whole debate of like, do I go to nursing school? Do I go to med school? Like, I think a lot of people have. But ultimately, I decided to go to nursing school because in my mind, and this is maybe not a correct perception, but my perception at that time was medicine is really focused on like the disease itself, whereas I felt nursing was more holistic and looking at the person. And yes, they might have this disease, but that's just like one part of it. And I kind of just liked that philosophy overall more than medicine. And again, that might not be the correct perception. That was just what I had at the time. Mm-hmm.
more patient-centered than disease-centered.
Exactly. So I went to nursing school to get that clinical background. I continued to do research in nursing school. And again, it kind of was a complete shift from like this very basic science, heavy focused research to more patient-centered community health research that kind of got the whole spectrum there. Yes. But I knew in nursing school I wanted to continue to do research because that was the part that I like loved the most. I also like taking care of patients as well, but I also loved research.
It's okay to like both.
So then I went and did a PhD here at the UW School of Nursing. And my focus was on broadly cancer survivorship, but I did take an interest in kind of more of the cardiovascular effects of cancer and its treatment. I wanted to continue to do some of the biological research that I had done in my undergrad, so I was doing a lot of work looking at biomarkers associated with cardiovascular disease risk in cancer patients. And then I ended up doing a postdoc in cardiovascular medicine at the University of Michigan to get more experience in the kind of the cardiovascular space. And then I came back here just in September as an assistant professor, back to the School of Nursing to kind of tie all of this together.
We're so glad you did.
Thanks. Yeah, no, it's been great to be back, and it's a great department, and I feel like I can kind of, again, like explore all of these different avenues that I've been interested in, and there's a lot of resources here to be able to do that.
The explorer piece definitely comes out in the digging deeper into these different disciplines and then bringing it all together.
Yeah.
Oncology and cardiovascular health, and that's for some folks, they could spend a whole career in just one particular area, and it's lovely to see how you've been able to build that theme of, I don't know if it would be described as holistic health, but build that theme of patient-centeredness into several different disciplines, and then kind of bringing it to the digital health piece, finding commonality in that space too.
Yeah, I mean, I'd say, my work is very multidisciplinary. So the actual field, there's an actual field called cardio-oncology. It's actually its own discipline now because of this recognized impact of cancer and its treatment on the heart. Yeah. That, by definition, is multidisciplinary.
Of course.
You have cardiology, you have oncology. A lot of my work is in kind of more in like the public health realm, so looking at epidemiology. Mm-hmm. There's kind of that biological component to it.
Yes.
And then as I kind of move from this kind of more biological focused research looking at, risk prediction, modeling, et cetera, to more risk mitigation, then that kind of opens up a whole nother set of collaborators. So a lot of what I'm wanting to do now is exercise-focused interventions to improve cardiovascular health. So that brings in cancer rehabilitation, physical therapy. So it's kind of like depending on, what project I'm on, I have 4 or 5 different disciplines plus in each of these different projects. But it's nice to kind of have that expertise.
And they all, we're a unified system, right? So they all are integrated. Like, it's all necessary. You can't just isolate it and talk about one thing. You have to see where all of these things interconnect and inter-influence each other too. So it makes sense that you would bring all of that together. And then you had your project that you shared with all of us, with the public and with us at School of Nursing in November at Dawg Tank. Do you want to tell us a little bit about that project and maybe how it intersects with all of the work you've done so far?
Yeah, so I'll kind of provide just a brief background to kind of the initial project that this stems from.
Yes, please. Yes.
So like I mentioned, a lot of my prior work as a PhD student and as a postdoc was looking at how to identify individuals who are at highest risk of developing cardiovascular complications after cancer and cancer treatment. And a lot of that led to, we have like this high-risk group that we were able to identify, at least in the population I was looking at, which was bone marrow transplant. So now that we know, this group of individuals is at really high risk of developing complications, what can we do about it to hopefully reduce that risk? Mm-hmm. So that kind of led to my recent K grant that was just submitted in a month ago, February. I'm like, what month are we in?
I know time is kind of mushing together at the beginning of this year.
Right. Okay. But that is an exercise prehab intervention to hopefully improve the cardiovascular health of people who are undergoing bone marrow transplant so that they're more fit to undergo transplant. And hopefully that'll like reduce some of the impacts of transplant on the heart. One of the things that's really challenging about exercise interventions is getting people to actually exercise.
I imagine so.
Pretty challenging, even for somebody like me. Like, fortunately, I don't have any chronic conditions, but it's very hard to motivate, to do it, to find the time. So the Dawg Tank piece was to develop a chatbot that takes all of the physical activity data that's being collected from like a wearable device, and it basically will provide, or the idea is that it would provide motivation through text based on the recorded data. So if somebody, we have specific goals for them in terms of exercise targets and their heart rate targets, et cetera. But the goal is like, if somebody is not meeting those targets, it'll send some like nice words of encouragement, like, hey, you've only completed 2 of your 5 exercise sessions this week, keep it up, et cetera. If somebody's like crushing their goals, it's going to provide, positive encouragement, like great job. So it's going to kind of merge with the wearable technology. So all of the different data points that are coming in through that, and provide more tailored, personalized messaging to hopefully help with that adherence and motivation piece, just to keep people on track.
That sounds way more effective, dare I say, than the ring close. Good job. You closed your ring. Right. Or a little bit more tailored, It's more
tailored, but it's kind of based on that model of like, that's also recording your activity, but it's easy to ignore.
Have you stood yet? It's time to stand. Right.
I'm just not standing.
I'm sorry. I'm just not going to do that. Versus building a sense of, okay, this is tailored to me. This is giving me feedback on the actions that I'm taking, and I'm getting, kind of kudos and cheered on for this. And sometimes when people are getting started on something new, and in particular, I would imagine someone who's also dealing with what you're describing, preparation for serious conditions, that sometimes there can be isolation, or perhaps even not wanting to tell other people that you're trying to exercise, or perhaps feeling like, oh, if I do that, there's going to be more pressure that I have to exercise. So this kind of allows for them to have that without the pressure.
Exactly. It's kind of like a nice non-judgmental friend helping you out versus like, if I'm the one sending a message like, oh, like you need to exercise, there's kind of like that judgmental component to it. And we're trying to remove that piece and make it, kind of like a friend that's like not a human being that has like that kind of emotional attachment to it.
You're not being judged by a chatbot, which is great.
Correct. Yeah. That's the idea.
For better or for worse. So what's next do you foresee on the horizon in the field of digital health innovation? What do you just generally, I know it's a big question, and you could go a lot of different directions. So feel free to play. You're an explorer. What are some things that come to your mind?
I mean, in terms of the wearable health space, I think there's a lot that can be done. I think just having this wealth of data that can be collected remotely is a really valuable resource, because people can, I feel like the model right now is you let's say you go to your primary care and, or like you have cancer and you go to your primary care and, they're going to collect data from you at that point in time, but they might not have the data that, data on what you've been doing for the last week, the last month, or all the time points in between those 2 visits. So I think there's a lot of directions you can go in with collecting kind of continuous data, continuous health data through remote technology that can be used to kind of, look at patterns and see how that might impact somebody's health or outcomes, or that can be used by the clinicians so that they're having kind of a nice broad overview of everything that's happening in someone's life when they're not seen at that one point in time in a clinic setting. So that's kind of one area that I see digital health going. I think there are many other areas, but in terms of like kind of where I'm most interested, I think having just that continuous data monitoring can do a lot for like precision health, for kind of looking at all aspects of a patient's life and not just the disease and not just like kind of those data points you collect at one point in time.
So as opposed to one point in time, and also filling in the gaps, because providers don't see that space in between. They don't see, and there's self-reporting, right?
And there's self-reporting, and it's hard to recall. I mean, I don't know what I did last week. It's really
Absolutely.
hard. Yeah, like I don't know what I ate. I don't know, like, you know, all of that exercise data that even I have in my own personal life. So having just it being tracked for you and, you know, aggregated for you in a way that can be digested and meaningful for clinicians will be really helpful to kind of fill in those gaps.
And I see opportunity perhaps for artificial intelligence to help with like drawing out insights or anomalies, things like that, perhaps?
Absolutely, absolutely. I mean, when you have all of this data, I mean, it can be pretty hard to know what to do with it. And that's where I think AI and machine learning will be really, really valuable at just interpreting this data and finding those patterns that can be hopefully used in more of a clinically meaningful way.
What are some of the opportunity spaces in the machine learning and health and, you know, application that you see?
I think it's really wide open right now. I mean, some of the areas that I've dabbled in and I'm most interested in is the risk prediction space. So identifying individuals who are at high risk of developing, whether it's cardiovascular complications or just other outcomes after cancer and cancer treatment. You know, a lot of the current research is focused on more like traditional risk factors. So, you know, like different lifestyle characteristics, like, you know, exercise, smoking, different comorbidities. But there's so much more. You know, those models only work so well. There's a huge gap that we don't know. Again, they're not taking into account this holistic view of somebody. So this is where precision health, machine learning, AI can be really valuable at taking data points across a whole spectrum of categories. So you have like your traditional risk factors, but let's say you have all this continuous physical activity monitoring or, you know, information on the environment, the social determinants of health, genetics or epigenetics, proteomics, all of these different omics. If you have all of this data, then you can use machine learning to hopefully create some sort of model that's going to be hopefully really predictive. But you need to be able to collect all of this data, which is currently really challenging. It's really expensive. There's issues with data storage. But if you have it, then you can hopefully use some of those more sophisticated tools to, again, create some sort of useful model from it.
Have you seen some challenges with consent, like consenting for health data to be used for some of these predictive analytics that you're talking about?
That's a great question. In my research, most of what we're doing is like de-identified data or data that you know, it's because it's de-identified, you don't need to get consent for. Mm-hmm. Or we're using de-identified blood specimens. So again, we don't really need consent for that. But I do foresee that being a potential issue, especially, you know, if you're doing prospective collection and you do need some of those identifiers. You know, I think there's certainly some hesitancy on how, you know, if you think about like all the stuff with like 23andMe.
Right.
There's some hesitancy around that. But I think with education and just, you know, and making sure we have systems in place that are going to protect data and protect identity, then I think then that is a barrier that can be overcome with time.
So that's a space that we need to see more people working in and more further infrastructure or policy making, et cetera, built out around that. My spouse is one of those people who he's like, no, I'll never do 23andMe ever.
Well,
right?
It's kind of scary because you hear those stories, you know, well, there's like that one big case of the person who, you know, was caught for murder because his uncle or cousin or somebody submitted 23andMe. Mm-hmm. And that is a real concern. Yeah. And then, you know, what are people going to do with your data? How is it going to be secure? Like, it might be secure now, but what about 100 years from now?
Right. What's the what's the limitation? Right. Is this data now yours forever? Can it be used forever? When does data become sort of public domain too? When does health data become public domain? This is such a fascinating conversation, Lexi. And when you think about the space that nursing occupies in all this, do you feel like nursing science brings something unique as we're kind of moving towards this leading edge?
I do. And I think our angle and something that we do best is we've always looked at people holistically. That's always been part of the nursing philosophy. I think other fields are actually catching on to that, which is great. But I don't think nursing has ever just looked at, like I said, a disease or specific disease characteristics. I think they've always looked at like, well, what's your life like at home? Well, what are your social connections? What's your diet like, your environment, your neighborhood like? So because of that, I think we're really leaders in that space at identifying the other important areas of a person's life that need to be accounted for, not just, do you have diabetes or not? So I think nursing is great at that. And the other thing that nursing I think is great at is, again, because we're not just focused on diseases, I think nursing has like a nice lens, like what are some of the other outcomes that are maybe a little bit more impactful in patients' lives, like their symptoms, their quality of life, their physical function and functional status. So having a focus that's not just on, and I do study a lot of like cardiovascular disease after cancer, and that is maybe a little bit more medically focused, but how does that impact quality of life and future symptoms? I mean, and that's what patients care most about, is how they feel. If you have cardiovascular disease but you don't have any symptoms, maybe it's not something to worry as much about, but it's the symptoms that really bother people. So, and we've always kind of had a greater focus on outcomes besides just the disease. So I think those are two areas that nursing does well.
And it makes it real for people when you think about, the role and the profession of nursing having been, I think, the most trusted profession for the past 22 years. And I know we're talking about science and we're talking about, research, but I think that your work occupies a unique space of looking from the nursing lens. That's a trusted lens in our community. So leverage that, right? Leverage that lens and that trust to help people to have better lives and live better lives and have better health.
Yeah, absolutely. And that's a great point. We're really in a very unique and valued space in this. And I think people, especially patients, they listen to nursing. So I think that's a great point. Yeah.
So someone might hear these things that you're talking about, and they might hear opportunities for themselves or things that they never thought that they could work in, research they never thought that they could do, that they start to go, oh, wait, I see myself in Lexi's story, or I see myself being interested in combining these different disciplines. What advice would you have to someone who is maybe on the cusp of thinking about a career change or a career advancement or additional education or perhaps a pivot into research even?
Yeah, and then that's a big question. To kind of answer maybe like the last piece of what you just mentioned, if people are interested in research, I think one of the best things you can do is find a mentor and just start getting some exposure to research. So find a faculty member that, you're interested in their work or resonates with you in some way. See if you can, either volunteer your time or see if you can work with them to just get exposure to what research is, what the life looks like, what are the aspects of research, like what does the job look like, what are we doing on a day-to-day, and find a mentor that is going to give you the time that you need and wants you to succeed and is going to be there to support you along the way. And it doesn't have to be even a nursing mentor. So I did my postdoc actually in the School of Medicine, outside of nursing, because the mentor that I had at University of Michigan really kind of fit all of the characteristics of somebody that I was looking for in a disease or, research focus that I was interested in. So I think it's just finding that right person who's going to give you the time and energy that you need and just getting exposure to different areas. I from being a PhD student to now, my research was similar along the way, but just working on different projects and getting exposed to different coursework and topics, it really shifts. And it's going to shift no matter what, because research changes, science changes, it's always evolving. So just getting that exposure to different areas is really helpful to kind of kind of keep with where the directions are going, keep up to date on what the current state of the science is, what are some of the current newer methods. So it's always evolving. You're always learning. So it's a great field to be in if you're a lifelong learner like myself and really love to go to school.
Never stop learning.
Never stop learning, because, I mean, things will always change. And my research, as I mentioned, it kind of started out with more of like biological focuses, and then I did risk prediction, and now I'm doing lifestyle interventions, and now I'm dabbling in digital health. So it like really has evolved over the years. So
love how you've followed the science and followed your passion areas, right? And there's something to be said, I think, for following curiosity, right? Because curiosity is just this hungry thing. And if you can follow it, it will lead you to all sorts of unexpected places.
Absolutely. And then your research leads you to new places. So as you identify or discover something in a project, that might open up another door like that you hadn't thought about before. Like, oh, like maybe I need to like follow this path a little bit more, see where it goes. So you have to kind of go into it with just an open mind and being curious.
So can I ask you why oncology and cardiology, like why were those disciplines in particular interesting to you?
That's a great question that it's kind of funny. I sometimes will go back and look at my entrance exam or admission exam for the PhD program to be like, what was I thinking at that time? Because I feel like what I wrote in that essay was so broad. And I was interested in cancer and or cardiovascular disease because those are like the two top, killers in the US. And again, when I was working in a lab as an undergraduate student, I was studying this extremely rare genetic condition. And I wanted to have a bigger impact. So I pretty much went like to the complete opposite end. Like I want to like actually study the things that are like really killing people year after year. These are like the two like biggest diseases. And I didn't know at the time that there was actually a subspecialty that combined the two. So I pretty much wrote in my entrance essay, like, I want to do cardiovascular disease research or oncology research. Two very, very different things. But as I started the program, I was introduced to it by another faculty here, Dr. Carrie Redding. And then I was like, oh, wait, there's actually a field that does both. And I was so happy and excited to know that actually existed. So then I kind of have since gone down that path. But it was really just because I wanted to have an impact. And those two at the time just resonated with me.
That makes perfect sense. It makes perfect sense. It just puts all the pieces together when you think of like starting in this niche spot and going, yes, this will have some positive impact, but who really, right, in the grand scheme of things, and to take it to the point of going, what's really affecting people's lives, what's harming people day to day, and their loved ones and our communities, right? What gaps is this leaving with of people that could otherwise still be with us, right? So thank you so much for this work that you're doing and the research that you're providing to our community. This is very exciting stuff.
Thank you. I really appreciate it. And I love what I do, and I'm really glad that I get to do it all the time now and have kind of the freedom to be able to explore all of these different avenues.
Well, I'm glad that you came here to share it with us today. Is there anything else that you'd like to share with our audience before we wrap?
I think that about sums it up. I mean, I really hope that, if students are interested in research, if you're an undergraduate student, you're interested, always welcome to reach out to me. I'm happy to help in any way I can. I mean, like I said, I've had great mentors that have got me to this point, and that's something I'd love to give back to.
Well, thank you so much, Lexi. Dr. Alexi Vasbinder joined us today, and we were so grateful to have her with us. Thank you, and have a fantastic day.
Thanks, you too.
Thank you for tuning in to University of Washington School of Nursing's Voices of Nursing podcast. Join us next time as we continue to explore topics vital to nursing, health, and well-being. Until then, stay informed, stay inspired, and stay engaged. And don't forget, follow Voices of Nursing wherever you listen to your favorite podcasts so you'll get every show as soon as it's released.